Thank you, Dave, and again, congratulations, Jill. It gives me a great deal of pleasure to introduce our guest speaker today. I've known him most of my life, grade school, junior high school, and the University of Idaho. Dave graduated a couple years ahead of me in 1966. He then went on to the Northwestern School of Medicine and has been practicing in the Magic Valley area since 1982. He comes from a very distinguished and long line of family physicians. His grandfather first started practicing in Buell in 1908. His father was instrumental in starting the Twin Falls Clinic in 1944, 1945. Dave, as I said, has been practicing since 1982 in Twin Falls and informs me that he's got a young son that's going to be joining him in that practice in the not too distant future, so you'll have had 4 generations of McCluskys practicing medicine in the Magic Valley, and that's quite an accomplishment. Currently, Dave's been involved with the Camp Rainbow Gold, which is a cancer camp for young children. He's been instrumental in working as a volunteer member of the staff for the Mustard Tree Wellness Clinic, which is now, I think, just being called the Wellness Tree Clinic for a variety of different reasons. In 1993, he was voted Chamber Person of the Year. So please help me welcome Dr. David McClusky.
Thank you very much. I appreciate the opportunity to be here and talk to you about our clinic, a little bit about how it started, who's on the board, what we're doing, and kind of what our dreams and our goals are for the future. I might say that my young son, David, who I think now is going to be coming back here, has said that, you know, Dad, most of what you do is of historic interest only because we, the new generations of physicians, do it a different way. So I suppose it'll be pretty quickly he'll be pushing me out of the way. But the idea of the mustard started out as a mustard seed. It was back in 2004. Dr. Richard Sanderson and John Sextons were the two that got together, and it was actually at the Mustard Tree thrift shop. They had a little chair, and they did blood pressures and checked people that maybe needed some health care. And from that, we then I talked with them about a navigator system, and from there we started out the Mustard Seed Clinic, and we changed it to the Mustard Tree Clinic, and now it's the Wellness Tree Clinic. Just because of a lot of political and economical things, we've made those changes. So now when you hear, I still call it the Mustard Seed Clinic because I can't remember that many things, you know. I'm in the springtime of my senility, and it's kind of hard, so I just learn things once and that's it. So, but anyway, I also probably need to make a disclaimer because I am a employee of Magic Valley Hospital, and when I speak anything to do with healthcare, they like to have me make a disclaimer of who I am, what I am, so that I don't impinge upon, make them look bad. But what I just want to say is I'm a conservative person. I live by the Hippocratic Oath. I'm not politically correct. I do not support Obamacare, and I'm a Christian. So that's my disclaimers, okay? I think I've found in trying to get this together, sometimes our biggest challenge is not treating the disease and taking care of the diagnosis of our people. It's how we're able to get the people through the system so we can do that. And I think what we found is one of the reasons this clinic started was because we saw the need of people in this community who did not have access to health care. And those people are the illegal aliens that are here, the refugees after 6 months of care from the college, people that are drug addicted, the working poor without insurance, those who have lost their insurance or lost their jobs and are in between those, and the people who are homeless, and indigent workers who are coming here. I just saw one last night in the clinic. He actually lives in Wyoming, but he's here doing a job for one of the companies here and doesn't have a doctor, any health care. And so we saw this need, and that's what started the clinic. And so the exciting thing is this last year, 2012, we saw 2,536 patients visits in the clinic. We did over 1,000 blood pressure checks. And I think what we're doing there is we're seeing patients that don't need to go to the emergency room because it's not an emergency, but they have no access to health care. And so if you look at what we take a dollar that's given to us, and I think we turn it into about $60 worth of health care. And so if you look at that, considering what it cost us to run our clinic last year, we saved the hospital or this community $2.5 million in what we do in this. So everybody at the clinic is a volunteer, except for our, we have 2 paid employees. Joni, who runs the clinic, and without her, you know, it's just like my nurse. I mean, I can't function without my nurse, so, and we can't function without her at the clinic. But then we have so many wonderful volunteers that are there. And we introduced Kathy and Sherry, which were there. I also want to say Tom Mikesell comes and works there once a week. And Dr. Pika is one of our physicians that works there. And I understand, John, you're going to be there?
Oh, sure.
All right. So well, we need you for that. But and so it's very exciting, the number of people. We have probably close to 130 people that come and volunteer their services, their time there at the clinic. And I think that's really amazing that we have a community of people that will come and do that and make a difference. Because the people we treat there really don't have access to health care. And the health care system isn't getting any better. I think we're going to see more and more of them. But we've enjoyed it. And I think our philosophy was also always that we started out by listening as to what were the needs of the community. Then we decided to learn about what those needs were. Then we decided to go ahead and give a helping hand to the people who have those needs. And now we feel our goal is to lead the community and the rest of the state of Idaho and the rest of this country into where we can go and how we can make a difference and help people. Because I think that the health of your community is only as healthy as the people who live in that community. And if we as a community, we as healthcare providers and all the rest of you that help us don't take care of these people, then we won't have a healthy community. And the other exciting thing about this clinic is that it's also an opportunity for the young students that are going into healthcare to come and participate. You see, my PA students, my residents, the nursing students, the dental students all come to this clinic and see patients, and they take care of them. And this is the first opportunity they have to really go out and understand what the real world is all about. And they make a difference, because without them we probably couldn't see this many people, because they are part of the volunteers that make this happen. And so and the exciting thing is we look at the problems that are needed. And when we first started, it was just trying to get somebody to see somebody and find out what their problems were, and then navigate them into the system. And then we found that 2 of the things that were very difficult for us to do were people that have dental problems and people that have mental health problems. Well, the dental problem, it's been very exciting because we've worked with the College of Idaho, the CSI, to set up, they have the dental assistants and, let's see, and the hygienist, yeah. God, my mind, you know, that's, and they come there at our clinic and see patients there, make the diagnosis, then they send them to the clinic there at CSI, and then they get treated in the community by either there at CSI or the dentist that will take care of them. And so we've taken care of that problem. The mental health problem is a real challenge. It's a challenge because we don't have enough providers to take care of what we need to do. It is a huge problem, and as you could guess, probably 75% of the people that we see in that clinic have mental health problems. And so we're just started working with, we had a group come together, and I think we're going to be able to solve that problem in the future, because we have a lot of people that are interested in helping us solve that problem and to take care of those people. I worked there last night. 3 of the 7 patients I saw were there because of mental health problems. So the scary thing is the general surgeon is treating those people, but at least they're getting something and somebody's sitting there. But we need the right people there to take care of them. And so I think I'm very excited about where we're going there. I'm also very excited about how this community has come behind our clinic. And I have to give credit for those who really have made a difference. The hospital has made a big difference. They do support us. They've been very supportive of us. We do have our challenges, but we work through those. And they've been very supportive monetarily and also to help us as a support. The county and the county commissioners have been great with us. As you know, our new facility now is in the old hospital in the emergency room. And I promise you, you go there, it looks better than the emergency room did when it was the emergency room of the hospital, because we've completely redone it and it's beautiful. And they have been so gracious to us. The rent that we pay for that is just, you know, it's really a shame that we'd only pay that much. But I think what we do and bring to them is fine. And so if you see the county commissioners, you have to thank them for making this possible, so that at where we were before we came there, we were spending, you know, about $32,000 a year for rent. And when you take that and multiply it, each one of those dollars by $60, that's a lot of money and so they've made that, so that's, Glanbia has been huge. The money that they've given us to start that. They were the ones that gave us the first big funds. And we have all kinds of people in the community that are now supporting us and doing it. The one thing that we will not do at that clinic is take one penny from the government. As long as I'm there and president, that will, because once we do, what we have to do now in that clinic is so overwhelming that we couldn't afford to keep it open. And so we just said, you know, we don't want your money, you know, we want to do the right thing, and we don't want Jaco and you know, all the people coming down here seeing us, and it's been a challenge, but I don't think we're going to change that, because that's how we can make a difference. What I keep telling the government is, I said, you know, why don't you come down and we'll teach you how to solve all the problems that for some reason you can't solve nowadays, you know? And I've always said that, you know, I told them, I said, you know, some people walk in the rain, others just get wet, and all you guys do is get wet. We at least walk in the rain and enjoy it, and I think that at the clinic, that's one of the things that's exciting. If you come work there, you'll find that it's a great atmosphere. The people that work there are there, and they're just some of the finest people in the community. And any of you that want to, you know, come join us, you can. Same way with the students. We love to have you there. And we're going to have an open house, I think, on April the 10th. Yeah. And so we'd hope you'd come to see our new facility. I think one of the things that I like to say is that sometimes if you look to see what this clinic is, it's kind of a beam of light that's shining out of the storm of healthcare, the tornado of healthcare that we're in now. And there's beams shining out there. And sometimes we have to look at those beams and follow where they came from. And if we do, we can solve the problems of that storm. And I think that's really, we're just a small little beam coming out there, showing the world how we can make a difference and touch the lives of people who are just human beings like us, but don't have access to health care like they should. And one of the things that we say at our clinic is that, you know, we have as our motto, the free clinic is centered on the belief that citizens who work at being productive should not be denied ordinary medical care while making their own efforts to provide for themselves and their families. And our purpose is to provide health care services to these individuals. And I also, I took one of my favorite sayings is, it says, at whatever time you come, you'll find a light, help, and human kindness. That was on the lamppost of Albert Schweitzer's Jungle Hospital. And so we have that as our model there. And so we are that light that if the world would follow, maybe we could solve the problems of health care. Nothing more, at least we could solve the problems of the people and help them the way we do. So it's exciting for me to come before you and let you know a little bit about who we are, where we came from. Like I said, when we started this, it was kind of like everybody, actually many people told us, well, you're just a Band-Aid and you're not really needed. And I said, no, we're not a Band-Aid. I promise you, once we get started, you're not going to be able to get rid of us because of the important role that we play in your community. And I'll make sure that we play that important role so you can't get rid of us. And if you know me, you know, you know. You know, I'll die beating you, but I'll beat you. So we'll get there. And so what I'm saying is it's been exciting to be a part of that. And I've always said my motto was, you know, I jump and I'll build my wings on the way down. And I've never hit the ground yet. And it's because of people like you and the people that work there that put feathers in that wing so that will never happen. And so we just wanted to let you know that we'd like this opportunity to come speak to you. We welcome you to come to our open house and see what we're doing. And if you have anyone that needs our help, please let us know. And I truly appreciate all of you that participate and help taking care of our patients and work with us there. And you know, but God sent us Joni, and that's why we're doing so well. And so, you know, with her there, they could put up with people like myself. And I'll just finish by telling you who our board of directors are. We have a wonderful board of directors. We started out with a bunch of us old guys, and you know, that started it out, but now we've got a community-supported board. And so I'm still the president, but I believe in term limits, so that won't be forever. The medical director is Lisa Burgett. Our treasurer is Julie Paulo. Our secretary is Deb Annist. And our directors are David Snyder, who's vice president of Glambia Global Relations and Foods. Bonnie Steffens, who's a nurse practitioner. Dr. Bob Love, who we decided that, you know, he didn't have to spend so much time down in Mexico. He needed to come and do something for his community now that he's retired, so he's on our board. Susan Bass, who works at the Magic Valley in the emergency room. Sandra Sexton, who's John Sexton's wife. Brent Jessel. And this is news. Jeff Harris was just nominated to be on our board last night. So I think the world is made up of angels walking around dressed up and looking like human beings. And that's what makes us do what we're able to do, because of those wonderful people. And so I just want to thank you for letting us have the time. And do you want to say anything, Joni? No, she doesn't. Okay, so and appreciate the fact that you let us come and talk to you. And I want to welcome you to come to our open house. I think you'll find what we do and the service that we do wonderful, and hope you will at least support us in letting them know that we have that clinic and there's a need for it. And if you know somebody that needs to come there, please make sure that we get to see them and take care of them. So I appreciate the opportunity to speak here, and thank you very much.